Warm welcome to Dr. Eidelman.
Thanks a lot, Steve. Well, I think there are a few people still coming from the other, people coming from the other room still? Or? All right. Well, welcome, and we all had a little patience running a little late here, but so chelation therapy is as a medical practitioner, a medical doctor, I've had the opportunity to check out quite a variety of different treatments over the years. And chelation therapy is probably the single most effective, least toxic treatment that I've come across for quite a wide range of different conditions, both as prevention and therapy. And the word chelation comes from the Greek word claw, to grab onto or wrap around. And so most people are familiar with chelation. If you go to the health food store and buy nutritional supplements, there are chelated minerals. And that means that the minerals are attached to, wrapped around by amino acids, because the intestinal wall generally will not allow in minerals that are just by themselves. They have to be chelated or connected to these amino acids, and then they come in very easily. Well, chelation therapy is taking it from the other side of putting in this case, a synthetic amino acid, EDTA, ethylene diamine tetraacetic acid, which grabs onto heavy metals and then pulls it out of the body through the urine. It goes out through the kidneys. So the EDTA is a synthetic amino acid. It was developed in Germany around the time of World War II for industrial purposes, mainly for fixing dyes. And then it was realized that it's non-toxic and can be used in the body. And so it was originally used for treatment of heavy metal poisoning, arsenic and lead. And it came to the United States and was initially used for lead poisoning in industrial workers primarily at the beginning. And so they started treating these employees of these industrial firms with the EDTA. And some of them, besides the lead poisoning, also had coronary artery disease or other types of arterial blockages. And it so happened that in the treatment of their lead poisoning, that their coronary artery disease and other arterial blockages tended to open up. So their angina was disappearing, their claudication, which is the condition when you have blockages in the legs, disappeared. And so this was a surprise to the doctors who were treating the lead poisoning, and so it was written up. There were a couple of cardiologists who got excited about it at the beginning and wrote it up in a cardiology journal in the 50s. And then something happened after the first article came out, in which they were very excited about this new treatment for coronary artery disease. And then when the next edition of the journal came out, they recanted with sort of vague reasons of why they thought they were wrong in the first place. But around this time, which was in the 50s, there was a young doctor who's actually now an Arizona resident named Gary Gordon. And he, at the time, around the age 29, had a heart attack, and then he had another heart attack, and he was trying to figure out what is he going to do, and he came across chelation therapy, and he used it on himself and managed to get cured or healed. And so he became naturally an enthusiastic proponent of it, and is oftentimes considered the father of chelation therapy, and he was the co-founder of a medical organization now known as the American College for Advancement in Medicine, or ACAM for short. And then he's just recently started a new organization called the International College for Advanced Longevity Medicine, and which just had its first conference a couple of months ago in Las Vegas. And ACAM has focused on the effects of chelation therapy in cleaning out the arteries. And ICALM is more focused in general on longevity medicine, and one of the things that chelation therapy has proven, you might say, in the long-term usage is that it does have anti-aging effects. And one of the most remarkable aspects of it, which hasn't gotten much publicity, is the fact that in at least 2 studies, retrospective studies, that it showed that people who had been through chelation therapy had an approximately 90% reduction in cancer incidence. So it not only cleans out the arteries, but it seems to protect against cancer. So here you have a therapy that's beneficial in the 2 most serious killer diseases that we have. Now, we wouldn't want to say, or I wouldn't want to claim, that chelation therapy by itself is a treatment for cancer, although in the cancer clinics in Mexico and around the world, chelation therapy is usually used as an adjunct, and it's helpful in the treatment of cancer, but certainly by itself would not be claimed to be a treatment for cancer, although I think that we can say that it's part of the treatment program for coronary artery disease or blocked arteries anywhere in the body. And again, it's part of a program that would include changes in diet, changes in lifestyle, increased exercise, stress reduction, all these factors. So it's not exactly what you would call a magic bullet, although it sometimes works that way. For example, I had a patient come, he wasn't actually my patient, but he came to a talk that I gave on chelation therapy, and afterwards was sharing his experience. And he was 71 years old at the time, and he described that 12 years before, when he was 59 years old, he had a second heart attack. And he went to UCLA, to the medical center there, and they did an angiogram, and they told him he's got 3 blocked arteries and he needs coronary bypass surgery. But it was the Friday night before Super Bowl weekend, and they said they would operate him on Monday. So he said, fine, can I go home for the weekend? They said, okay, but just be here Sunday afternoon. So he went home and went to his usual hamburger joint where he would eat every night, and he goes there, and the lady behind the counter says, oh, where have you been the last few days? He says, oh, I had a heart attack, and I was in the hospital. Now I have to have chelation. Now I have to have bypass surgery. And the lady says, oh, well, my husband, they told him he needed to have bypass surgery, and he had chelation therapy and didn't need it. Here's the number of the doctor. Why don't you call him tomorrow and check it out? And the office was open on Saturday, and he went over there, and he got the lowdown on it, and he decided he would do it partly for financial reasons. Bypass surgery is $50,000. He didn't have insurance, and they were going to allow him to pay it off over time, but still that's $50,000. So he decided that he was going to do the chelation. So he goes to the hospital on Sunday to tell them that he's not going to do the operation. And a young lady doctor who did the angiogram was there, and she was upset, took him down to the radiology department, showed him the blocked arteries in the film, said, if you don't do the bypass, you're going to be dead in 6 months. And he says, I don't care, I don't have a family, you know, if I die, it's okay. And anyway, he could have kind of afford a few $1,000s for chelation therapy, a lot better than $50,000 for bypass. So he went ahead, he had the chelation therapy, 20 treatments in about 3 times a week for 7 weeks. And then he was okay after that, and he was a construction worker. He worked long hours outside. After that, was able to go back to work. He never had another treatment. 12 years later, came in just, you know, to connect with a chelation doctor, not even to get more treatments, and he'd been fine ever since then. Now, usually, we recommend a follow-up. People do a series of 20 to 40 treatments, And then once the series is over, we do recommend an average of once a month to maintenance. And so he was kind of unusual, because I don't believe he'd made very many lifestyle changes. He was still kind of roly-poly. So he was a kind of your best case scenario, if you will. But it's a sign that you can be called a walking time bomb, which many doctors will do this to scare the patients, to get them to go into the operation right away. You're a walking time bomb, you better get operated on today or you might be dead tomorrow. And of course the research in bypass surgery does not show a increased longevity from even conservative medical treatment, not to mention comparison with chelation therapy. But so even if you're told you're a walking time bomb, you still can do chelation therapy with success. But you have to be intelligent. I just had a patient this last week. He came in, he's a 54-year-old man with, and he had coronary artery disease, angina, could walk maybe a half a block, he'd start feeling chest pain. And the doctor told him they wanted to do angioplasty, and he said no, and came in for chelation. So I was giving him chelation. He had 11 treatments and was improving. He wasn't needing to take nitro. He was doing very well. And then on last Saturday, it's 100 degrees in Ojai, and he owned some property that he was renting out, and he needed to install a new air conditioner. So by himself, using all of his strength, he installs the air conditioner, and has a heart attack. But, because he was stupid of, doing too much exercise. So you have to be intelligent, and you have to live intelligently, and in order for chelation therapy to work. But many people are able to, if he would have waited until he'd finished 20, 30 treatments, gotten himself back in shape, maybe he could have put in the air conditioner. But it's a funny situation in life. But chelation therapy is amazing, and I will tell you a few stories. There was one fisherman who came in, big guy, like 6'3", 300 and something pounds, very heavy, diabetic. He was told he had coronary artery disease, and they wanted to do angioplasty on him. And again, it came down to financial considerations for him. He couldn't afford angioplasty. The amount that they wanted as an upfront was the same amount that it was going to cost him to do a whole series of chelation. So he decided to do chelation. There's other reasons, of course. In angioplasty, they're at the most plowing through, if you will, one or two arteries. And in chelation therapy, you're cleaning out all of the arteries in the whole arterial tree. So it's a more intelligent thing to do anyway. Even if angioplasty works a little faster, you're still only getting the one artery, and then it blocks off pretty fast. So anyway, so this fellow, he was a fisherman, and his symptoms first came on when he was deep sea diving in Mexico, and he lost his breath underwater and started foaming at the mouth. And he managed to get up and be okay, but then he was diagnosed, and it turned out that he couldn't walk up the ramp to his boat without getting chest pain. And normally he'd have to carry big lobster traps. He was a lobster fisherman. And he was basically incapacitated. And by the time of his 10th treatment or so, he was able to work again. And even he said he felt better than he had in 10 or 15 years. He was working better than the younger guys. And then because of money, he kind of, after he started feeling better after his 10th treatment, he sort of started slowing down on the treatments. But even then, he said he would start to feel some chest discomfort and shortness of breath on carrying the 4th heavy trap up the ramp to his boat. So he had dramatic improvement. And then his buddy, his best friend, who also rented some space in his house, he had a bypass surgery. And he was sort of a smaller version, maybe, 5'8" or something like that, but also roly-poly, and a smoker who hadn't quit. And so he had the bypass surgery a couple of years ago, but it had failed, and so he was now back with chest pain and pretty much incapacitated. And so after his buddy was successfully treated with chelation therapy, he came in, and he had the series, and sure enough, his symptoms went away. And he hadn't really tested it out until one day somebody dropped by some lobster traps, and he needed to carry them up the hill to the house. And prior to the chelation therapy, he couldn't even have lifted one of the traps, much less carried up to the house. So this was his first trial to see how good a shape he was in, and he was able to carry all of the traps up to the house. But for financial reasons, he didn't do follow-up, and then a year later, his symptoms started coming back. He was still smoking. His diet still wasn't so good. And so we started another series of chelation therapy, and then after about 5 or 6 treatments, the symptoms were going away again. So chelation therapy is something that can work for preventing bypass surgery, and it can also work for preventing the second bypass surgery, because bypass surgeries are known to have a typical lifetime of 10 years. When you have a bypass, you can expect a second bypass 10 years later if you're lucky. Now I have another patient who had a bypass in the early days of bypass, and then he did some chelation therapy, and kind of then he stopped doing chelation therapy, but he had a second bypass 18 years later. If he had continued with a bypass, with a chelation, he probably wouldn't have needed a second one at all. But he had some in the middle there that helped him to prolong the lifetime of the bypass. So chelation therapy consists of several different ingredients. The protocol is recommended by ACAM. Contains EDTA, which is the synthetic amino acid ethylene diamine tetraacetic acid, which grabs onto heavy metals. So it's FDA approved for lead poisoning. And when a drug or a substance is FDA approved for one use, doctors are allowed to use it for other reasons that are not approved by the FDA. So even though the FDA doesn't necessarily believe that it's effective in treating blocked arteries, we're allowed to do it anyway. We're not necessarily allowed to make the claims, even though people do, but ACAM right now is in legal hot water for making claims about the cleaning out of the arteries. You're allowed to use it, you're just not allowed to talk about it. It's the same kind of thing with the vitamin supplements. On the labels, they just say, this is what the supplement is, and then after fighting, they were able to say these are some of the physiological effects of it, but you're not allowed to make health claims about it. And same thing with EDTA. Strictly speaking, you're only allowed to say that it treats heavy metal poisoning. So this lecture actually is slightly illegal. If there's any FDA agents in the audience. So there's EDTA in the mixture. I'll talk a little bit more about EDTA and some of the other things that it does too. And then in the ACAM protocol, there's about 10 grams of vitamin C, and then a whole range of B complex, B1, B2, B3, B5, B6, B12, folic acid. And then there's magnesium, about 1 gram of magnesium, and heparin. And all of these ingredients are important, possibly as important as the EDTA. As yet, I would love to see some controlled studies comparing the whole mixture as I just laid out, where there's another thing called the Myers cocktail, named after Dr. John Myers, that has 25 grams of vitamin C, plus calcium and trace minerals, plus all the other ingredients. And this also seems to have effects of opening up the arteries, and I would love to see a comparison study done with that. And then in the chelation protocol as recommended by ACAM, it's 3 grams of EDTA, and you have to give it very slowly, over about 3 hours. And the reason for that is that the only known significant toxicity of EDTA is if you give it too fast, that it grabs onto so many heavy metals and it goes out through the kidneys that if you have compromised kidney function, that it can jam up the kidneys. And in the early days of chelation therapy, when they didn't understand this and they would take the EDTA, push it in pretty fast, there were actually some people who went into kidney failure. And this was in the days prior to dialysis, and some people actually died from it. But now with a recommended protocol, which means that prior to beginning chelation therapy, you have kidney function tests, and if your kidney function is normal, then you can go ahead and have the full treatment. And if your kidney function is not normal, there's basically two categories of reasons for that. One reason is because your arteries into the kidneys are blocked. And if the arteries into the kidneys are blocked, then chelation therapy should open that up and improve the kidney function anyway. But you do have to be careful, and so if people do have compromised kidney function, then either you give lower doses of the EDTA very slowly, or else you just don't do it. But doctors using the ACAM protocol, as far as I know, there are no reported deaths as a result of chelation therapy. 0. From angioplasty and bypasses, there is a very significant mortality and morbidity rate. So EDTA, as I mentioned, is about as safe a therapy as you can get, chelation therapy. Now, the vitamin C is very important. Vitamin C is, of course, an antioxidant. The problem with the blockages of the arteries is not just cholesterol. They talk about good cholesterol, bad cholesterol. Well, there's cholesterol and there's oxidized cholesterol. And so the culprit tends to be the oxidized cholesterol. Now, EDTA is also an antioxidant. It's used as a food preservative. And so its effect as in chelation therapy may be as much from its antioxidant effects. We don't know for sure the exact mechanism of how it works. Some people think that it's because it grabs onto the calcium, pulls out the calcium. There's calcium in plaque. The plaque in the arteries is a kind of a mixture of oxidized cholesterol, calcium, and fibrous tissue. So some people believe that it's like pulling the calcium out of the coronary arteries, out of the plaque. But then there are people who doubt this mechanism, and it really isn't clear how it works or why it works. But there was another study that was done, one in America and then a larger study that was done in Brazil, that showed that if you gave half the amount of EDTA and half the amount of carrier fluid in half the amount of time, so that you sit in the IV chair for an hour and a half to 2 hours instead of 3 hours to 4 hours, with half the amount of EDTA but the full amount of all these other vitamins, magnesium and heparin, that it works almost just as well. And in fact, in my office, most of the patients do the hour and a half drip, and these patients who I was telling you about, the fishermen, they got well on the hour and a half drip. And within the community of chelating physicians now, there's a lot of controversy over this, and some doctors are saying, no, the hour and a half one isn't as good. You need to do the 3 hour one. So this is still an open question, and until there really are adequate comparative studies, we won't know for sure. And I hope that when these studies are done, that between the hour and a half one and the 3 hour one, that there's also a study done comparing that with the so-called Myers cocktail that I mentioned, which often can be given in 45 minutes. So that's even faster. And well, my first really sort of miraculous case with the using the Myers cocktail was a lady who was diabetic, and she had ulcers on both feet that weren't healing, and she had osteomyelitis in her left leg, and the doctors wanted to amputate. And she had one of these kind of a ports so that she could put antibiotics intravenously into her own vein without having to stick herself every time. to try and treat the osteomyelitis. And so she lived kind of far away from where I was and couldn't really afford to come in for the regular treatments anyway. So I gave her the setup of all the vitamins and minerals and IV bags and everything to take home, and then she could just plug it into that port. And within 2 weeks of doing this 3 times a week, the ulcers in her feet had healed, and the osteomyelitis was gone in her legs. So these are very dramatic therapies. Let's see here. Any questions so far? Yeah, the high-density lipoproteins is not oxidized. It's the low density that carries the oxidized cholesterol. And so that's why the difference between the so-called good cholesterol and bad cholesterol. Right. Cholesterol is in every cell of the body. It's part of the cell membrane. It's a precursor of a variety of different kind of hormones, neurotransmitters. It's one of the most important substances in the body. Without cholesterol, you're history. And so there are studies that show that people whose cholesterols are too low suffer from a variety of different problems, and one of them can be cancer. There was a study, there are actually a couple of different studies of people taking cholesterol-lowering drugs that showed that even though there was a lower incidence of heart disease, that there was not an overall lowered incidence of mortality, and that in fact that these people who were taking the cholesterol-lowering drugs had a higher incidence of strange and violent deaths, including suicide, murder, car accidents, and things like that. So. Okay, the question is, if you don't eat enough cholesterol, is it true that your body makes cholesterol? Your body makes cholesterol. The liver makes enough cholesterol. Well, let's say that in most cases the body makes enough cholesterol. The thing about the cholesterol-lowering drugs is that that they generally tend to bind cholesterol in the gut, because the cholesterol, it has a complicated cycling and recycling mechanism through the creation of bile salts going into the intestinal wall and then being reabsorbed. And the cholesterol-lowering drugs, for the most part, prevent the reabsorption of the cholesterol. And so even if you make your own cholesterol and then it gets recycled and the body expects it to come back recycled and it doesn't, that's if you're on the drugs. But normally the body will make its own cholesterol, and also if you eat cholesterol, then the body will, in most cases, will shut down production, so it has its own regulatory mechanism. And there is a small percentage of people whose regulatory mechanism is out of whack, so that if you eat a lot of cholesterol, your body will still make cholesterol, and then your cholesterol is too high. But most people, even if they eat cholesterol, then the body will say, okay, we can kind of cool it on the production. Okay, right. The question is it true that that the silt in coffee raises cholesterol? And the answer is that if you put it through a filter, that the part of the coffee that raises the cholesterol gets filtered out. If you drink unfiltered coffee, like percolated, or I'm not sure whether espresso does this or not, there is an ingredient that will raise it. Now, how high it raises it, whether it's 10%, 20%, something like that, we're not talking about an outrageous increase, but a mild increase, yeah. Yes, sir.
Will this therapy clean out old DDT residue?
Will it clean out old DDT residue? What do you think?
I think it would be beneficial because it doesn't have a chelation effect, especially the vitamin C on chemicals in general.
Right.
I would certainly add some herbal remedies with it.
Okay. So,
Like
So,
The oil
right.
field comes that chelating
Okay.
herb that
Right. Okay. Right. So the okay. So I'm just going to kind of repeat that for the microphone. The mixture as such probably would help maybe as much because of the vitamin C in there as because of the EDTA. Again, EDTA, in addition to chelating or grabbing onto the heavy metals, also has antioxidant effects, and so will help in a variety of different things. Now, so far I've only mentioned the coronary artery disease or the blocked arteries, but also it tends to relieve the pain of arthritis, relieve arthritic pain from a variety of different conditions, including lupus. I've had patients who have glaucoma and their glaucoma reverses. I mentioned about the decreased incidence of cancer. So there's a variety of different conditions that are benefited. Yes, Paula?
Is that also for any viral, let's say, toxoplasmosis, things that have actually blood poisoning, or those types of viruses that are in the body? Would that clear out some things like
Okay.
toxoplasmosis?
Well, will this clear out viruses and other type of organisms? Well, I wouldn't want to say that it clears out the viruses. Usually, if somebody has viral conditions, then you would use the Myers cocktail with a higher dose of vitamin C in it, and the trace minerals, particularly zinc. The EDTA pulls out the trace minerals also, and so you need to supplement with trace minerals. So in situations where I want somebody to have the minerals, I'll usually give them the Myers cocktail instead of the chelation therapy.
I do have another question.
Uh-huh.
In regards to preventative, would you suggest someone that is just wanting to, whether it be the fountain youth, or
Right.
just the fact that anything that they might feel, and maybe pull back on the EDTA and use the minerals and the vitamins and go through maybe that half dose process, just to end up being preventative? I mean,
Well,
suggest those for
sure. It's a wonderful prevention, especially if you have a history of heart disease in your family, or a history of cancer in your family, or a history of arthritis in your family. Then this is a wonderful prevention. A couple of $1,000s worth of prevention is better than a $50,000 cure that doesn't work. So yeah, it's absolutely it's a fabulous form of prevention. And what is the problem you're trying to eliminate with EDTA? Well, well, in this case, you're talking about clogged arteries. And so you're trying to clean out the arteries. But you're also trying to get rid of heavy metals. Heavy metals lead to free radical damage that cause blocked arteries, that causes cancer, that causes arthritis, that causes Alzheimer's disease. I didn't mention that. If you can get somebody relatively early on in Alzheimer's disease, then there are cases where people have their conditions are reversed.
The arteries aren't open, the free radicals get there, they get lodged there, and they just stay there and just burn like a nuclear particle. Burn everything.
Well, that's an oversimplification, but the free radical damage will promote the arterial blockages, or at least that's what most people believe.
In other words, your veins act like your body ends up acting like a filter instead of a circulatory system.
Something like that. Yeah. Yes, sir.
One explanation I heard was the concept of the arteries having 3 layers and the free radical cells causing a bump, and then the cholesterol is the last thing to form. Would you comment on that, and also Halstead's latest, one of his books on chelation therapy that I have a copy of, it has some very excellent, probably some of the best photographs of cell structure.
Yeah. Well, there are a variety of different theories of how it develops, and there probably are a variety of different ways in how the blockages develop, and some of them are where you have damage to the different layers of the arterial wall and the plaque slowly builds up. There are other cases where there's probably like a more acute insult to the artery, and then there's like almost an explosion. So someone who doesn't have any symptoms at all, and then there's this damage to the arterial wall, and then a big kind of clot develops, and then you have like a heart attack like that. That's one mechanism of it. So there are a variety of different mechanisms.
Just a follow-up, I've heard others who have criticized chelation therapy in that it's as if it removes the patch that's on the artery, and thereby the leaky gut or the leaky artery, it has, in effect, more damage. I'm not in that camp, but I was wondering if you comment.
Right. Well, the question is, does the EDTA chelation do more damage to the artery? And one of the gentlemen who's a speaker here said that he thought that maybe people who had too much chelation therapy, that it could damage their arteries. I myself am not necessarily a believer in that. I know there are some people for whom chelation doesn't get the kind of results that we would like, and then because we all believe in it and have seen such great results, usually then we'll keep treating them with chelation, or they'll keep coming back for chelation, and then after they've had a lot of chelation, they're still continuing to go downhill, and it would be tempting to say, well, the chelation might be causing damage to them, but I think it's more that it just isn't working in those cases. Yeah, Sonny? Maybe I haven't asked people to come up. There's a microphone for questions. Yeah. Yeah, that's it. I don't know. No. Try it again.
Okay?
Yeah.
Is it working?
Yeah.
Let me spin it around. I probably talk to sometimes as high as 25 people a day. I travel all over, and I have heard a lot about this type of therapy, and I've talked to a lot of people, and this is what the general consensus has been input to me. The first place the blood rebuilds itself in around 60 days, we have a complete new blood supply. So anything put into the blood doesn't last very long. And the other thing of it is anything inside the blood, we have what we call, like in the brain barrier, the blood barrier, so nothing will penetrate. I don't care what you put in the blood. There's only two things that will penetrate the blood barrier into the brain, and that's alcohol and water. And what was the other one? And DMSO, okay, DMSO. I don't know if we got that documented yet, but apparently it is, okay. But few things will penetrate that, so regardless. But this is what, and I mentioned to him, was the fact that anything put into the blood is not going to last too long. In certain areas, it will not penetrate, and if it was that fact that the body didn't have that protective mechanism, then we would be killed by either viruses, parasites, or whatever. So there's very few things, even injected into the blood, that do penetrate the body. And you know, it was explained to me we're a tube from end to end, and everything we ingest is like a sewer. And if that tube breaks, it'll kill us. We'll get gangrene almost overnight. So we're all enclosed. But the blood has the ability to program into you your own DNA. And they've proved recently that everybody has different DNA. Well, my consensus is this. How do we know that what we put into your blood or yours is the same? We do not. So we have a general consensus here of one liquid, you know, fitting all patterns, which I would question. The other thing of it is iron is very essential in the body. It's a pretty heavy metal. It's not like gold, but you know, some people say gold is good. Gold is definitely a heavy metal. Lead is a heavy metal. How about mercury? Is mercury a heavy metal? Sure it is. And how about iron? Well, I don't know, but it seems like to me if it was going to take some of the things out, then it would take some other things out like iron. Another thing like iron, if it's given in high dosages to young children, it's detrimental. So there's a lot about iron we don't know. The other thing I wanted to point out, and the last thing was the fact that I have talked to people in California, my local town. Recently they went in for treatments, and they said it helped them. And most people I've talked